Welcome to HPHA's Hip Replacement Surgery Pre-Admission Patient Education. The content was originally created by Vancouver Coastal Health and the Osteoarthritis Service Integration System and adapted by Grey Bruce Health Services. The Huron Perth Healthcare Alliance would like to generously thank them for permitting us to reproduce the information used to create part of this learning module. Some of the information has been slightly adapted by HPHA. This education module is narrated. Please ensure that you have the volume turned up loud enough for you to hear comfortably. To pause the video, click on the pause button. To restart the video, click on the play button. You may find it helpful to follow along with your booklet as you review this module. If you have someone assisting you with care after your surgery, you may want to ask them to review this module with you. If your surgeon or healthcare team gives you different advice than what has been provided in this booklet, please follow the specific directions you receive. This education module will be divided into 4 sections. Number 1, hip replacement surgery. Number 2, before surgery. Number 3, during your hospital stay. Number 4, after surgery. Please review all 4 modules. Afterwards, you can go back and review the individual modules as many times as you like. Module 1, hip replacement surgery. This information can be found on page 6 of your handbook. Hip anatomy. The hip joint is a ball and socket joint made up of 2 bones. This allows your hip to move in many directions. The ball is the round head of the thigh bone, which is your femur. It moves in the socket of your pelvis, which is your acetabulum. There's a small elastic type tissue, which is cartilage, that covers the ball in the socket. This tissue protects the surfaces of these 2 bones. Muscles and ligaments support and strengthen the joint. In total hip replacement surgery, the surgeon replaces the diseased joint with an artificial joint, the prosthesis. Once the new joint is in place, the muscles and ligaments are repaired. This surgery typically takes less than 2 hours. Let's watch a quick video about hip replacement surgery.
During a total hip replacement, your surgeon will replace your hip joint with a prosthetic hip. The hip joint includes the ball-shaped head of the femur, which fits into the socket or acetabulum of the pelvis. Smooth articular cartilage covers the bony surfaces, cushioning the hip joint and allowing the parts to move easily. The most common cause of hip disability is osteoarthritis, a chronic disease in which articular cartilage wears away, resulting in severe hip pain and stiffness. When pain medication and other treatments are no longer effective, your surgeon will perform a total hip replacement. During the procedure, your surgeon will remove the damaged cartilage and bone and reshape the bony surfaces to fit the prosthesis or artificial joint. A cemented artificial hip joint includes a socket with a smooth liner and a stem topped with a ball that replaces the femoral head. Your surgeon will cement these prosthetic components into place. Then your surgeon will fit the new femoral head into the new socket. Before closing the incision, your surgeon will check the new joint's range of motion to ensure it functions properly. Over 90% of patients experience dramatic pain relief and improved hip function with a new joint that will last about 15 to 20 years.
After surgery, you will need to follow hip precautions for 4 to 6 weeks, or as advised by your surgeon. Precautions are basic rules for protecting your new hip. Pages 8 and 9 of your booklet show you some of those basic rules for protecting your new hip after your surgery. Hip precautions include the following rules. Do not bend your hip past 90 degrees in lying, sitting, or standing. Do not cross your legs at the ankles or knees when lying, sitting, or standing. Do not twist your body or leg inward when lying, sitting, or standing.
My name is Nadina Walsh. I'm one of the occupational therapists with HPHA. We're going to be talking about hip precautions today. Hip precautions are rules or movements that you need to follow after your surgery. It's important to know that there's nothing physically stopping you or restricting you from doing these movements, but you need to follow the rules or you may be at risk of dislocating or damaging your new hip. You must follow these precautions for at least 6 weeks after your surgery, and please speak with your surgeon to talk about how long you'll have to follow those precautions for after that 6-week mark. I'm going to talk about the 3 hip precautions that you'll have to follow. The first one is no bending your hip past 90 degrees. So when I'm standing straight, my hip angle is at 0. As I am bending forward towards the ground, my hip is now approaching 90 degrees. I'm not allowed to bend any further, nor am I allowed to crouch down to the ground, because both those movements will be affecting my hip angle. When you're sitting, you're sitting at 90-degree angle in this position. This is allowed. From here, you are not allowed to bend forward or lean, nor are you allowed to bring your legs up. Both those movements affect the hip angle. The next restriction or precaution that you'll have to follow is no crossing the midline. So what that means is no crossing your legs, either at your knees or at your heels. The third precaution you'll need to remember is no twisting or turning your leg inwards. So no twisting or turning your leg inwards. When you're reaching for something, you'll have to take some small steps and turn in that direction. So keep that in mind when you're reaching for something high in the cupboard or wanting to turn to wash your hands at the sink. Turn your whole body in that direction. So now we're just going to go over how you sit in a chair. So what you're going to want to do, if it's my left leg that's affected, I'm going to use my walker. And I'm going to back up to the chair until I feel it behind my knees. It's important to not twist and turn to look for the chair, because that's one of the movements that we want to avoid. I'm going to feel it behind my knees. I'm going to bring my operated leg out. I'm going to reach back for the chair, and I'm going to slowly lower myself into a seated position. From there, I can push my bum back further in the chair. To get out of the chair, it's the same thing in the opposite direction. You're going to want to scooch forward in the chair, bring your affected leg out, and then you're going to push up as you're coming into standing. What you want to make sure that you're not doing, so you don't want to bend forward into a stand, because that's bending your hip more than 90 degrees. If your chair height is too low, consider adding a cushion or a wedge to increase the overall height of the chair. Hip precautions also have implications for how we're doing our everyday activities, like getting yourself dressed or sitting on a toilet. So we have adaptive equipment that will show you how to that will help you get your lower half dressed. So the first is a dressing stick. It's a long stick with some rubber coated hooks. Any of the tools that have long handles or long ropes eliminate or reduce how much bending forward you have to do, further than allowing you to follow those hip precautions. The dressing stick helps with pushing your shoes, pushing your socks off, or pushing your pants and underwear off. We have a sock aid that helps you to put your sock on. The long-handled shoe horn helps you to put your shoes on. You can also use this tool to push your shoes off, push your socks off. And then we have a reacher or a grabber. You can use this to pick items up off the floor. How it works, there's a trigger at one end and a clamp at the other. So what you can do is you squeeze the trigger to pick something up off the floor. You can also use this tool to help with putting your underwear and your pants on, which I'll show you. So to take your shoes off, you can use the dressing stick to push back, push from behind your heels and push them off. Same thing with your socks. Often pushing behind your heels works. Careful from this position to not turn your leg inwards. And push your socks off. From here, I can use the reacher to help put my pants on. When getting dressed, you're going to want to dress your affected side first. With underwear, you can use the reacher, Clamp on from the waistband all the way through to the leg hole, and then drop your underwear down and then shimmy up your foot. With pants, it's sometimes a little bit too much material to grab all at once, so you're going to want to grab just a handful of material on the affected side, drop it down, throw them out as far as you can, and slide your foot in. Generally, when your pants are at around your knee, you can reach with your hand and grab them. Same thing with your opposite side. Grab a handful of material, use the reacher, drop it down, and slide your foot in. From here, I can bring my operated side out, push myself up into a stand, and pull my pants up. To take my pants off, push them down to about your thighs, bring your affected leg out, reach back and feel the chair behind your knees. From here, I can use the dressing stick to push my pants off. To use the sock aid, it's important not to put the sock aid in between your legs, because this might kind of encourage that internal rotation of your leg. You're going to want to use this against your tummy if you can, and thread the sock on so that the heel goes to the bottom and to the back of the device, making sure it comes to the end. From there, use the long ropes to do the bending and reaching for you. Shimmy your foot in, and then slowly pull the sock on. From here, you can use the reacher to pull your sock up a little bit higher. So with your shoes, you can try elastic shoelaces. They're available at the medical supply stores. Elastic shoelaces, they expand as your foot goes in, and then they contract as your foot enters the shoe. Or you can try Velcro shoes as well. Bend the tongue back, drop your shoe down with the reacher, slide your foot in, and then you can use the long-handled shoe horn to guide your foot into the shoe. Okay, thank you.
Module 1 Summary. Your surgeon has determined that hip replacement surgery may help you to have more movement and less pain in your hip. The surgery takes about 2 hours to perform. You will have to follow special hip precautions or rules for the first 4 to 6 weeks after your surgery. These are outlined in pages 8 and 9 of your booklet. That brings us to the end of Module 1. When you're ready, please review Modules 2, 3, and 4.